Hello, everyone. We will begin this press conference at around 1 p.m. So stay informed by keeping involved and listening to us.
Words. Words and things.
Sit down.
Okay, Chad, we're going to be starting a little bit late. It'll be about 1:05 that we'll be going. So just as a heads up.
Are we on the webinar?
The broadcast
There we go.
starting. All attendees are in listen-only mode.
All right. Good afternoon, everybody. Thanks so much for being with us on this July 29th. Hard to believe it's almost August, and been a little bit more than 6 months since we saw our first case here in Maricopa County of COVID-19. So we marked that moment the other day talking about how long we've been in operations here as a unified command, as well as having the Joint Information Center. My name is Fields Mosley. I'm the Communications Director for Maricopa County, and I'd like to thank everybody, members of the media, for joining us here, as well as those members of the public who are joining us via Facebook and YouTube today. Thank you so much. We appreciate all your questions and your comments, and we're going to try to get to as many of those today as we possibly can. So today we're going to discuss how public health collects its data, then what do they do when they analyze that data to get you the information that's on our website, and how they utilize that information to expand their knowledge and understand how COVID-19 is moving throughout our community. Medical Director Dr. Rebecca Sonnenschein is here to talk a little bit more about that data, and we're going to do a little bit differently today. I'll get more into that in just a moment. We also have Marcy Flanagan. She's the Executive Director of the Maricopa County Department of Public Health. She's here to answer any questions members of the media might have about policy or things that are going on in Unified Command right now that affect the public health response. Also with us today, the Director of Emergency Management, Robert Rowley. He is here to talk a little bit more about personal protective equipment for schools. We first introduced this last week, and we talked about the starter kits that we were providing. So school nurses or an assigned person within a school had protective equipment to use if, in fact, they had to come in contact with somebody who is exhibiting symptoms at the school, and help that person deal with that before parents could respond and everything that might have to come with that, whether as a teacher or a student. So he'll talk a little bit more about how much we've distributed so far, as well as our other plans for personal protective equipment for schools as we get a little bit closer to some of the schools restarting in-person classes next month. So before we get started, members of the media, as always, you'll be called upon to ask your question, and you have to virtually raise your hand in the GoToWebinar. If it's not working for some reason and you keep trying it, don't just keep clicking. Sometimes there's a little bit of a delay, but ultimately you might have to sign out of GoToWebinar and sign back in, and we'll do our best to call upon you. When you have your hand raised and we call upon you for a question, please make sure the microphone on your computer or on your phone is unmuted so we can open up your microphone on this end. We cannot control the microphone on your device. So with that, I would invite Robert Rowley to get us started this afternoon and talk a little bit more about personal protective equipment and schools as we get closer to schools opening.
Thank you, Fields. Good afternoon. My name is Robert Rowley, and I'm the Director for the Maricopa County Department of Emergency Management. Approximately 2 weeks ago, the logistics section of the Maricopa County Unified Command began distributing 1,450 PPE starter kits for public, private, and charter schools throughout the county. These kits contain initial amounts of face shields, surgical masks, gloves, and gowns, and are designed to be used by school nurses and staff to safely respond to and care for persons exhibiting COVID-19 symptoms. To date, 191 starter kits have been picked up or are awaiting pickup by schools. This week, 669 more kits will be delivered to schools who could not come and get them, and 590 kits remain on hand for schools who have not yet responded. In addition to starter kits, the Unified Command will be purchasing 750,000 cloth masks, which will be distributed to schools who request them. Also, 500 5-gallon jugs of disinfectant and 25,000 bottles of hand sanitizer are also being purchased to keep on hand for distribution to schools if needed for emergency disinfection needs. Since April 7th of this year, the Unified Command has distributed over 2 million pieces of PPE to various entities requesting emergency supplies. This includes first responder agencies, schools, long-term care facilities, and even private healthcare providers. Regarding private healthcare providers, the Unified Command has partnered with the Arizona Medical Association, the Maricopa County Medical Society, and Action PPE to bring personal protective equipment to Arizona physicians. Any healthcare providers in emergency need of PPE can submit their request to actionppe.org/AZ. Thank you.
Thank you so much, Robert. Before we go to the public health section of our news conference today, I want to talk a little bit about testing efforts. For a long time, the county was not involved in the testing efforts. That was happening mostly at the state level. But what you've seen here in Maricopa County, as the demand for testing increased through June and into July, the state got more involved, also the city of Phoenix, as well as some other entities. We also have testing sites that are up and running right now. They started last week around Maricopa County. We are targeting areas of the valley, however, that really are populated with underserved populations. So we are specifically going into areas where people might have difficulty getting a bus to a testing location or having transportation to a testing location. So we're working with vendors who can stand up testing locations in those areas and making sure that people have access to testing across the entire county, and not just in those large parking lots where you have to drive there and wait your turn. So I'd like to mention our contractors we have so far. We are adding more people to this, or more organizations to this contract as necessary. Valle del Sol, Chicanos por la Casa, Native Health, Equality Health, and South Wellness are all under contract right now and providing these services. Now, if somebody needs testing, they're curious about these events going on in their neighborhoods, we have a website that is now up and it is live, maricopa.gov/COVID-19 testing. maricopa.gov/COVID-19 testing. There's a map there. There's a calendar with events. If you click on the events next to the actual calendar dates, it will take you into a window that will show you more information, as well as a map of how to get there and information on whether or not you need to pre-register. I think it's important to note, too, for the most part, these events are free events, so people can get free testing in these important communities. So we're going to go to a question and answer period now with public health, but at first we're going to I'm going to present some common questions that we get either into the Joint Information Center or we're seeing on social media a lot. People having general questions about data, and that's one reason we're talking about data today with Dr. Rebecca Sonnenschein. So Joanna Molina is also here. She is a public information officer for public health. She will be translating the answers that Dr. Sonnenschein gives, so to better benefit those who are either bilingual or speak Spanish, and those members of the media who are reporting in Spanish every single day. So as you all know, over the last 6 months, a lot of people in our community, they've learned a lot about what public health does. All of you know more about public health than you've ever known before, more than likely. Case investigations, contact tracing, percent positive, R naught, all these terms that none of us were familiar with 6 months ago. It's all a common part of our vocabulary now. So all of these concepts are common with public health and people that work in public health. And we think it's important that people better understand how public health collects data and then analyzes that local data so they can best inform the public about the spread of COVID-19. So getting now to some of these questions, I'll start off with one that we get quite often, and it is this. Public health posts data from the day before at 9 a.m. every morning. So what goes into getting those numbers, and why do the numbers look the way they do? And Dr. Sonnenschein will step up here and answer those questions. Then Joanna will translate that into Spanish.
Thank you, Fields, and good afternoon, everyone. We'll start with the fact that positive cases for COVID-19 are reported to the Arizona Department of Health Services, or ADHS, our state-level counterpart, through an electronic lab reporting system. And those come to us on a regular basis through a shared database with the state that we use to document all of our case investigations and all of the information we learn when we talk to cases. Each day at a set time, we pull the information from that database about all the new COVID-19 cases, hospitalizations, and deaths. Sometimes you'll notice that the data at the county level is slightly different than the data that you'll see on the ADHS website. That's because they may pull the data at a slightly different time, maybe even just a couple minutes apart. But even those 2 minutes apart, new cases come in and are reported and can change the numbers, and that's why sometimes it looks like it's off, but we can assure you that we're using the same data from a shared database, so it is the same in both parties. It's also why it's important to remember that the numbers that we post are not what actually happened in the last 24 hours. You'll hear those numbers reported often on the radio or in other media, and they'll say, 1,700 cases have been reported in the last 24 hours. That doesn't mean those people were diagnosed in the last 24 hours. They could have been diagnosed as long as 2 weeks ago, depending on how long it took them to get their lab testing and for that lab test to come back and get reported to public health. We combine the new data that we get every day with our existing data and compare the new numbers to the previous numbers, and we also monitor trends to look at the direction that things are moving. And now I'll invite Joanna Molina up to translate.
Y la pregunta común que reciben Salud Pública por lo regular es que los datos de Salud Pública se están actualizando constantemente, cada día a las 9 de la mañana. Pero, ¿qué es lo que significan esos números en sí? Bueno, para Salud Pública del Condado Maricopa cabe mencionar que esos números que llegan a nosotros primero salieron al Departamento de Servicios de Salud del Estado, conocido como ADHS. Y ellos tienen un sistema electrónico y de ahí obtenemos nosotros los números, los condados, y podemos saber cuáles son los números que pertenecen a nuestra área, incluyendo números de hospitalizaciones, números de casos y también de muertes o fallecimientos. Esos números son diferentes a los de ADHS, como mencioné anteriormente. ¿Por qué? Porque el horario en que nosotros los recogemos o se nos reporta puede ser diferente al horario que ellos están reportando, pero los números siguen siendo los mismos. Entonces, ¿cómo es que nosotros podemos escuchar a veces en los medios que surgió un gran número de casos en las últimas 24 horas? ¿Qué significa eso? Bueno, no significa que en las últimas 24 horas ese gran número de casos que se han reportado sucedieron en las últimas 24 horas. Significa que los laboratorios entraron y pusieron esos datos en el sistema electrónico donde nosotros los recibimos y podemos ponerlos ahora en nuestros datos. Pero esas son personas que se hicieron sus pruebas, diagnósticos anteriormente en diferentes tiempos, en diferentes fechas, no en las últimas 24 horas. Y por eso seguimos nosotros monitoreando constantemente para saber qué es lo que está sucediendo, cuáles son las modalidades de COVID-19 en el condado.
So a little primer there on where the numbers are coming from, and just in case a lot of people didn't know that, I think it's important to ask now about epidemiology and how do we use these numbers to track what the disease is doing in the community. And Dr. Sonnenschein will expand on that.
So we try to present our numbers in several ways so that people can understand all the different information that they provide. First, we use tables to show the percent of cases who are hospitalized and who have died. And we also use tables to compare hospitalization rates and death rates by different categories, such as age groups or race or ethnicity. The other tool that we use that we've talked about a lot is the epidemiology curve, or the EPI curve. And this is a type of chart that is updated daily on our site, and it monitors the number of cases and hospitalizations and deaths over time. And that allows us to show the trends. And what's important to know about those epidemiology curves is that the cases and hospitalizations are actually documented in the curve by the day that their lab was actually performed, the date that they had their blood drawn or their swab taken. And that's really important because a lot of times that is quite a bit before when the data is reported to us. When you're looking at the death EPI curve, or the number of people who died each day, it's actually based on the date of death. So sometimes you'll hear on the radio that there were hundreds of deaths that occurred in the last 24 hours. That's not actually accurate. That means that about 100 deaths were reported to us in the last 24 hours, but those deaths could have occurred on any number of days, depending on how long it took for the cause of death to be determined, whether or not it went to the medical examiner, and a variety of other things that can delay the information. The EPI curves allow us to watch trends in as close to as real time as possible. But as you have been hearing, and as I've mentioned before, there are things that are outside of public health's control that affect how up to date the data is, particularly the time it takes for when someone gets their lab drawn to when it's reported to public health. And I know that everyone is working really hard to improve that turnaround time, but right now it's taking an average of 9 days between when somebody gets their specimen collected and when that lab result is reported to public health. So we account for this lag time in those epidemiology curves by graying out or lightening the bars that are incomplete data. And what you'll notice if you look at our EPI curves recently compared to the ones in the beginning is it used to be only 5 or 6 or 7 bars that are grayed out. Now it's many more bars, 10 to 15 bars that are grayed out because we know those data aren't complete. And we only put a trend line over the data that's darkened and that we know to be complete. So when you look at our EPI curves, you know that those data are complete, reliable, and accurate as long as the information is in that dark area with the trend line. And those delays do not actually affect the data that we are presenting.
La pregunta es, ¿cómo usamos esos números una vez que llegan los números a salud pública al condado Maricopa? Bueno, nosotros usamos esos números en epidemiología. Los usamos a través de gráficas que ustedes pueden ver en nuestra página de internet y mostramos ya sean las hospitalizaciones, el índice de defunciones. También en las gráficas podemos mostrar las edades, los grupos étnicos, también por raza y origen. También tenemos otra herramienta llamada curva epidemiológica. Esa nos muestra los casos más en tiempo real. Exactamente mostramos fechas en que se colectaron quizás las pruebas de las personas una vez que mostraron al laboratorio. También cuando hablamos de las muertes y escuchamos que hubo un gran número de muertes de un día para otro, no necesariamente puede ser la información correcta. Esas muertes se van registrando a través del tiempo y cuando llegan los reportes a salud pública es que ya se confirmaron y hablamos que si la persona fue hospitalizada, falleció quizás en un hospital o quizás fue al médico forense y tardó más tiempo en reportarse esa información a salud pública al condado Maricopa. También la curva epidemiológica nos ayuda, pero hay cosas que están fuera de nuestro control, como mostramos el tiempo que se tardan los laboratorios en hacer las pruebas y tener resultados y reportarlo a salud pública al condado Maricopa. Entonces, esos son señales que podemos ver también en la curva epidemiológica en nuestra página. Ustedes van a ver quizás los colores más fuertes, que significa que son los datos que tenemos al momento. Y hay áreas que te muestran qué días todavía no tenemos los datos al momento. Entonces, eso es como la curva epidemiológica nos ayuda a tener información al momento, pero hay retrasos que están fuera de nuestro control.
So now to a subject or a question that we get comments on our Facebook page and we see on Twitter occasionally. Some people that are getting phone calls but saying they tested positive, but they never got tested, or at least that's the story that we see. So how does that impact case counts? Are people truly getting false phone calls, and does this affect the counting of the data later on? Dr. Sonnenschein?
So I wanted to clear up some of the mystery behind what happens with those automated phone calls and how that affects the data that we report on our website. So the primary reason why someone who never got tested would receive a phone call that says someone with this phone number tested positive is because of an inaccurate phone number being provided or a phone number being entered into the system wrongly, either by the person who's giving the phone number or by the person who's doing data entry. And we have thousands and thousands of cases, so we understand that there are going to be some typos that happen. And if you know that you haven't been tested, then we have a line in the message that simply says, disregard the information if you've not been tested. And we do understand that some people have been tested multiple times and it's confusing. So it's always important that if you're confused about whether or not your test is positive, to go back and call your provider to make sure that your result that we provided is accurate. So what I want to explain is why, when someone enters an inaccurate phone number, that does not impact our case numbers at all. Our database actually creates a record for each individual person when a positive test result is put into the system. And that test result comes with a name and a date of birth, and it is filed by that name and the date of birth. It has nothing to do with the phone number. If a person is tested multiple times, it is always put into the same case file under that person's name, and that positive test is only reported one time. So when you see the number of cases on our website, each person is only represented one time. And that process is completely separate from the accuracy of people's contact information. So again, even if someone got a phone call saying they were positive but they never got tested, that wouldn't be entered into our case counts. And for the same reason, people who get tested multiple times are only counted once. We do also run programs to make sure that if there are duplicate results that are accidentally reported, we pull those out, and that's something we do routinely for all infectious diseases that are reported to us. And another way to look at that is it's kind of like how your doctor's office has a medical record for you. When you get your CAT scan results or your lab tests, all of your results go into a single record, and there's only one record when you go to pick up your medical records.
Otra de las preguntas que se nos hace frecuentemente es que se reciben quizás la gente llamadas de parte de Salud Pública diciendo que resultaron positivos a una prueba de COVID-19, sin embargo las personas nunca se hicieron una prueba. ¿A qué se debe si esos números se cuentan también cuando hacemos ese tipo de llamadas? Bueno, lo que pasa con las llamadas, cuando la gente recibe esas llamadas, puede ser por dos motivos. Alguien nos dio ese número telefónico cuando se hizo la prueba y llenó la documentación, o se metió incorrectamente al sistema, ya sea por algún personal del Departamento de Salud o quien haya tomado ese récord. Pero si usted sabe que no se ha hecho la prueba y recibe esta llamada, al final del mensaje usted va a encontrar también la información que dice que ignore el mensaje si usted no se ha hecho la prueba. Y si usted se ha hecho la prueba y tiene dudas, márquele a su proveedor médico donde usted se haya hecho la prueba para verificar también el resultado. Bueno, y ese número que cuando no contamos las llamadas no se cuenta 2 veces o 3 veces, ni cuentan el número totales de casos de salud pública, porque cada caso viene con un nombre y una fecha de nacimiento. Entonces, si una persona se hace múltiples exámenes o pruebas de COVID-19, pero sigue siendo el mismo nombre y la misma fecha de nacimiento, solamente se va a contar una sola vez. También tenemos programas que verifican constantemente que no se estén duplicando casos con los nombres y fechas de nacimiento que sean los mismos. Otro ejemplo que podemos poner es que cuando uno va al médico, se hace pruebas, se hace laboratorio, se hace revisiones, pero todo eso cae sobre un nombre, una identificación, es el mismo archivo del paciente.
Okay, last question that we want to go through real quickly. What does public health do with the data? What is the role of public health once they've collected this data, they've analyzed this data? What does that lead to next? Dr. Sonnenschein?
Our primary role when there is an outbreak of communicable diseases or even one case is to collect the data, analyze the data, and make recommendations for interventions to stop the spread of disease based on the information we have about the disease and the data we collect. The most important step once we receive a report of a COVID-19 case is contacting the person to let them know they are positive so they can isolate away from other people, not spread the disease, and so they know what to do next. Secondly, we investigate the case or interview the person, and sometimes their healthcare provider or the facility they're in, depending on the situation, and learn when they developed their symptoms, when they became infectious, and who they exposed while they were infectious. Public health uses the information they learn to provide that person with individualized guidance on how long they need to stay isolated, when they should seek care if their symptoms worsen, and generally how to keep the disease from spreading to others. All of this is done by a highly trained public health investigator. Then, once the information about who is exposed by that case is given to the investigator, that information is electronically transferred. That's the contacts information is electronically transferred to the Crisis Response Network, or AZ211, who then notifies the contacts that they have been exposed and provides specific recommendations to them based on the exposure. These are the contact tracers, and they enroll these contacts into a system that monitors their symptoms daily, and if the person develops symptoms, the system flags a public health investigator to then call that person, tell them to isolate, make sure they know what to do next and how to seek care, and then they would interview that case if that person then became a case. We do this same process, the same kind of work, only it's typically the investigator does the entire investigation and contact tracing for over 80 reportable diseases. This is something that we do all year long, all the time, and we've simply adapted our usual processes to the thousands of COVID-19 cases that we're receiving and divided it into two steps, with the contact tracing being delegated out to our partners at Crisis Response Network. All the recommendations that we make vary based on the particular situation and the disease that we're dealing with. So a foodborne disease would have very different recommendations than a disease that's transmitted by droplets like flu or COVID-19, or even one that is transmitted in tiny airborne particles like tuberculosis or measles. Our recommendations also vary by whether it's an isolated case or we have evidence of community-wide spread that requires a much larger coordinated response, like with COVID-19. For each disease and case, our goal is to provide specific guidance based on the situation and disease to make sure the person is aware of their diagnosis, does not spread it further, and that anyone else who's been exposed is aware of the exposure. And it's important that we take all the information from the literature and the information from our local area to make the best recommendations possible for our cases. A lot of people think that we actually enforce these recommendations. When we provide guidance, we are trusting the public that they will do the right thing and do what they need to do to prevent the spread of the disease. Our role is not to set regulations, and we do not enforce them except in very rare circumstances. Our role and our expertise is in analyzing data and communicating recommendations based on those data to people with infectious diseases and decision makers. I'm proud to say that we have an amazing team of experienced experts that are providing all of our public and our decision makers with data-based information every day.
Una de las preguntas también que es frecuente es qué se hace con los números y cuál es el rol de salud pública una vez que tenemos esos números o datos. Bueno, hay varias partes. La primera es que nuestro trabajo es dar recomendaciones y contactar a las personas que han estado enfermas o infectadas para saber qué es lo que deben de hacer y evitar la propagación. Dos, también damos seguimiento a los casos para saber dónde se presentaron los síntomas, con qué personas estuvieron en contacto cercano, quiénes son esas personas y también poder trabajar con otros socios como la línea telefónica de emergencia o de crisis de emergencia 211 para también monitorear diariamente estos casos por si llegaran a desarrollar síntomas y darles también guía personalizada. Ese es el proceso que usamos nosotros en Salud Pública para más de 80 enfermedades que son contagiosas y que se pueden reportar a Salud Pública del Condado Maricopa, solo que ahora lo dividimos en múltiples categorías, en programas para poder ayudar y facilitar más rápido el proceso de COVID-19. Lo mismo pasa con los casos ya sea de sarampión, los casos de tuberculosis, se les da seguimiento y damos guía para evitar que se siga la propagación y también damos recomendaciones, pero no somos una agencia que enforza, que vamos a obligar a nadie. Confiamos en que el individuo va a seguir las instrucciones y la guía que se le ha dado por parte de Salud Pública del Condado Maricopa. Tenemos un gran equipo, nosotros expertos en salud pública y epidemiología, para dar seguimiento a estos casos y poder hablar con cada individuo que es afectado.
All right, a lot of information there for the last 20 minutes or so. So I know we got a little bit of a late start. We'll go right up until 2 o'clock if we can today. At this point, I'd like to open it up to questions from members of the media who are joining us. So Chad, if there's somebody with their hand raised, please call on them.
Yes, Rachel Limegang has our first question. Rachel, your microphone's live.
Hi, Fields. We've been looking into the overall death numbers, not just COVID, in the state and in the county. And it looks like the number of deaths is beyond what has been officially contributed to COVID. So I'm wondering if Dr. Sunshine can weigh in on what may be happening here, if there are deaths beyond COVID that you're seeing that are higher than normal levels, or if it's, I guess, the coding of COVID over time getting more complete, or anything that could be happening.
All right, Dr. Sunshine, well, obviously we can't speculate. There's a lot of study that goes into what is actually causing people to die, especially when we see a large increase. We certainly know COVID is a part of that equation right now. Dr. Sunshine can expand on that a little bit more.
Looking at our death numbers, I think what's important is comparing what we've seen in all of 2020 to 2019, we are seeing significantly more deaths overall in 2020 compared to 2019. Because it takes some time for the cause of death to be determined, there's always a delay in figuring out exactly what that's due to. So that's something we're working very hard to figure out. We know that a proportion of them are going to be directly due to COVID. And we know from both our own data and from international data that there are likely to be some deaths that are indirectly due to COVID-19. For instance, as with influenza, if somebody has congestive heart failure or underlying lung disease, they may have a very minor infection with COVID-19, but that worsens their lung disease or their heart failure, and then they may actually succumb from the heart failure or the lung disease, and we may not even know about the COVID-19. There are other examples that we're seeing that may indirectly lead to death, where people who have chronic conditions, perhaps diabetes, or other ones that require regular visits to a healthcare provider, where because of the interruption in healthcare when things first came about in COVID-19, they may have delayed those visits, and their chronic illness may have worsened, and they may have ended up dying from their chronic illness due to these indirect effects and to the COVID-19 response. So I think it's going to take us some time to figure out which ones are indirectly due to COVID, which ones are directly due to COVID, and if all of the increase can be attributed to COVID or if there's something else going on as well.
La pregunta es que si estamos viendo números mucho más altos de defunciones o de muertes, ¿y acaso esos números se pueden relacionar a COVID-19 o se le atribuyen a COVID-19? Y estamos viendo que en el 2020, comparando al 2019, sí, en el 2020 se han registrado mucho más grande el número de muertes este año, pero toma tiempo para verificar la razón o la causa de muerte de una persona. Algunas pueden ser causas secundarias, por ejemplo, si una persona tiene problemas del corazón, problemas del pulmón y llegar a padecer de COVID, pero puede empeorar quizás la persona por las causas que tenía ya médicas del corazón o del pulmón y quizás nunca vamos a saber que fue una causa de muerte quizás por COVID-19. Otros problemas también de salud que contribuyen, puede ser la diabetes y otros efectos también por falta de atención médica. Con todo lo que está pasando, quizás mucha gente detenga ir al médico o se espera a ir a otras fechas para atender su situación personal y eso va a tomar un poco de tiempo saber cuáles son las causas exactas o si son directamente relacionadas a COVID-19 o si son indirectamente.
Rachel, thank you so much for the question. Chad, who do we have next?
Peter Seymour has the next question. Peter?
Okay.
Yes, good afternoon. So in relation to that last question, what are the numbers looking like in the morgue? Or is the county still approaching surge capacity or going the other way? And as another question, I might as well sneak it in here. What's being done to reduce the testing backlog? Is that a county function? Does the state have to handle that? Could there be a cooperation here?
So, unless I'm corrected, the testing function is a state function. The lab function is a state function, and so you would have to ask ADHS how they're. I know the governor's addressed it, Dr. Chris has addressed it about how they're trying to end that backlog and work with those partner labs that are out there. Sonora Quest has been one of the largest. But to get back to your next question, I believe the capacity today and the internal coolers at the medical examiner's office, we don't usually call it a morgue, but it is 142 decedents that are in the medical examiner's office today. As you all know from what we've presented in the past, it's 150 is our normal capacity, and anything above that, up to 209, is considered surge capacity, and that's at the time we start planning for what might be next and how much our intake is within that entire system that involves funeral homes. So I don't know. Director Rowley, no more to add to that. So, Peter, does that answer your question? And I think the obvious. Sorry, go ahead.
Yeah, we just had a technical glitch here. Yes, I think it works. I think that answers my question. No other changes since you last updated us on something that's not called the morgue. Got it.
Fair enough. And I think one of those, one of the obvious questions, are we using the coolers, the extra coolers that we have ordered? No, we have not had to use those yet. But that's something we're watching that number every single day. And very important to watch during this time whenever we have a lot of hospitalizations. Obviously, the entire system that deals with the unfortunate factor of death in our community, those are things that we're watching very closely and how we fit into that larger system. So with that, Chad, let's go on to the next caller. Oh, sorry. Joanna's going to answer this in Spanish. Sorry. When I get to going, I forget.
Bueno, fueron dos preguntas en una. Vamos a contestar de una por una. Es cómo se miran los números en la morgue, y la segunda pregunta es qué se está haciendo para movilizar o agilizar los números de los laboratorios que den los resultados más rápidos. Bueno, empezamos con la segunda respuesta. Ese es un trabajo que es del Departamento de Servicios de Salud del Estado de Arizona, que ellos trabajan con los laboratorios. Es una pregunta que se le debe de hacer al Departamento precisamente de Salud del Estado. Para responder la primera pregunta, ¿cómo se miran los números en la morgue? Nosotros no le llamamos morgue porque no tenemos morgue en el condado de Maricopa. Sin embargo, el médico forense al momento cuenta con 142 cuerpos. Obviamente la capacidad es para 150. Hay capacidad extra, pero ya es cuando entra como una emergencia. Sabemos también que la pregunta que nos han hecho bastante es que si están utilizando los refrigeradores que se trajeron en caso de que se necesitaran. Y al momento no se está utilizando ninguno de esos refrigeradores para guardar cuerpos.
I'm sure Joanna said, made it sound much better than what I said in Spanish. So thank you, Joanna. Chad, who do we have next on the line?
And Ryman is next. Okay. And your microphone is self-muted. If you'll unmute it, we can hear you now.
Hi, it seems like there's still quite a few infections among residents and staff at long-term care facilities. And I'm wondering, has your strategy changed at all as we get further into the pandemic and you're having, more facilities dealing with the outbreaks, or you might have facilities that deal with one outbreak, but then they get that under control and have another one?
Dr. Sonnenschein will talk about outbreaks or clusters inside long-term care facilities for you, Ann.
Thanks for that question. As we've talked about from the very beginning, we have been monitoring both cases and outbreaks in long-term care facilities very closely. And what I will tell you is that the long-term care facility residents used to represent the majority of our deaths and a large proportion of our cases, but that is no longer the case. Right now, long-term care facility residents represent the minority of both cases and deaths. And I like to attribute that to the long-term care facilities partnering with us to make sure that when we have a single case identified in either staff or a resident, we immediately work with them to put every single person on isolation precautions. I also want to applaud them for following all of the CMS guidelines and the CDC guidelines and restricting visitation, as hard as that is on family members and on the residents themselves. So all of those things combined have really limited spread. I don't want to say that there are no cases in long-term care facilities, and I'm just pulling up the data right here. We currently have 208 facilities that have had a confirmed case in a resident or staff person in the prior 28 days. And we have closed 128 outbreaks in long-term care facilities. And to close one, that means that you go 28 days without a new case. In answer to your question, have we seen situations where they've gone the 28 days, not had a single case, and then they took off the isolation precautions and then they had another case? That has occurred in a few situations. And those are situations where if it occurs again, we go back out and we work with the facility to see if there's anything we can observe in their infection control processes to help them figure out what's going on. And I also want to highlight that the vendors that Fields mentioned earlier have been assigned. We're working with all of the long-term care facilities that are not being tested by CMS. CMS has given the CMS licensed facilities a machine, Sophia 2, so that they can do their own testing. And not only are we sending vendors in to provide testing for both long-term care facilities and assisted living, but we're also looking in to see if we can provide some of those machines for facilities.
La pregunta es que las infecciones en los centros de cuidado de largo plazo siguen creciendo y que si existe una nueva forma de tratar o de lidiar con este crecimiento de números. Bueno, al momento estamos monitoreando Salud Pública del Condado de Maricopa los casos en los centros de cuidado de largo plazo. Eran los números que mirábamos anteriormente con números más grandes de casos y de muertes. Sin embargo, esos números ya se han mantenido y ahora los estamos viendo en otros grupos. Queremos atribuir eso a que estamos trabajando muy de la mano con estos centros de cuidado a largo plazo y también que ellos están siguiendo los lineamientos por CDC o el Centro de Control de Prevención de Enfermedades y también los lineamientos del Estado, del Departamento de Salud. Al momento hay 208 centros que en 28 días no han tenido ningún tipo de brote. 128 fueron cerrados debido a los brotes que se presentaron en 28 días. Sin embargo, una vez que pasan los 28 días sin ningún caso, se vuelve a reabrir y se cierra el caso de brote. Y si llegaran a surgir nuevos casos, obviamente estaríamos revisando cada uno de ellos. Cabe mencionar que estamos trabajando con contratistas que están haciendo estas pruebas de COVID-19 en diferentes lugares que son de alto riesgo. Obviamente aquellos que no tengan un lugar para hacer estas pruebas, nuestros contratistas podrían entrar y también utilizar lo que nosotros tenemos, una máquina llamada Sophia 2 que puede ayudar en el control de ese tipo de enfermedades.
Ann, thank you so much for the question. Since we're running short on time, Chad, who do we have next?
Leon Gonzalez has our
Okay.
next question. Leon, your microphone's live.
Thank you. I would like to know, according to Maricopa County data, what's the percentage of Latino deaths and coronavirus cases in Maricopa County?
So whether or not we divide up that data, do you have that? It's in this? Okay. So Dr. Sunshine will look up that data for you, Leon, and we'll answer that question.
So I can partially answer that question. We do post the race and ethnicity data on our website daily. And what I can tell you about our cases is that we do it by a rate per 100,000 persons of Hispanic or Latino ethnicity. And it's 1,616.8 is the rate per 100,000 persons. And when you compare that to non-Hispanic or Latino members of the public, that rate is 691.5. So what you can see is that the rate among Hispanics and Latinos is almost 3 times as high as among non-Hispanics and Latinos, and that's for cases. And unfortunately, I don't have the race and ethnicity data for individuals who have died at this point. Those data are always somewhat delayed because it does take some time to confirm deaths.
Bueno, la pregunta es, ¿cuál es el porcentaje de latinos con COVID-19 en el condado? Bueno, esa pregunta la podemos contestar parcialmente porque esos datos los tenemos en el sistema. Pueden entrar a nuestra página de internet maricopa.gov COVID-19 ES para español, pero contestaremos parcialmente. Los números que vemos al momento son de 100,000 personas en adelante. Podemos ver el índice y sabemos que comparado a otros grupos, el grupo de latinos son 3 veces más alto comparado a otros grupos que están infectados con COVID-19. Por eso es muy importante estar monitoreando los casos que tenemos en nuestra página de internet, ya que a la mano ahorita no los tenemos, pero los pueden ver en nuestra página.
Thank you, Leon, for the question. Chad, who else do we have?
That was the last question.
All right. Well, we're finishing up just on time then. I'd like to thank everybody for joining us today via the webinar. Thank you for the members of the public joining us on Facebook and YouTube. We always appreciate your time. Reporters, great questions. Thank you so much. We will continue to update you, hopefully on a weekly basis, most weeks anyway, and we'll let you know the next time we're available. Thanks so much.